When I joined the Mental Health Day Hospital, there was quite a large number of people who were waiting for services, approximately 100 individuals who had been identified via their GP and the assessment centre as would benefit from anxiety management work. Quite a large cohort of those individuals had undertaken either one-to-one work or psychological interventions before, who were maybe more psychologically aware and we felt would be appropriate for the seminar. We set up a seminar and we planned that in the town of Bangor. And the reason why we decided to do this was that everybody that would be coming along to the seminar would be there as a delegate. And that embraces some of the principles about recovery and how we work and how we practice. Also that each person there is taking responsibility for their own well-being, so they're going to take some of the skills away that's going to suit their lives and suit what they'd like to achieve. It was quite a long day. It was actually focusing on aspects about their own personal recovery, but also giving them opportunities in small groups to share some of their own recovery journeys or own stories, but also have that facilitated by skilled members of the team so we can ensure that people get the best out of the day.
Follow-up would suggest that people were able to take some of the skills they learned that day and sort of incorporate them into their everyday lives and hopefully reduce the anxiety. And from my point of view then, a couple of people were then able to access the Positive Steps programmes that we're running through Neve, through the Beacon Centre and also in floating support. So that will continue the work.
We also then looked at how we delivered services generally within the day hospital, and we wanted to make sure that our services were accessible and again timeliness. So we offered services and we offered group work in the peninsula, but also in Bangor and in Ards, and we looked at service delivering that outside the usual working hours. We want to continue doing the seminars, but we also are doing a piece of work where we've secured funding from the Public Health Agency about the Glasgow Steps, and that's a model where it's again education based, where people can go to like an evening class and hopefully we're going to run that in parallel or in partnership with SERC, so we'll be able to run evening classes in Bangor and in Ards as well, then down the road in Downpatrick and in Lisburn.